Good morning and welcome to the Caregiver Teleconnection. My name is Glenda Rogers and I'm going to be facilitating today's session with Dr. Tam Cummings. And our session today is brought to us by Vitas Healthcare, and Candace Ramos is with us and she is going to tell us a little bit about Vitas, except she went away.
Here I am.
There you are. Okay, Candace, go ahead.
Thank you so much. So really quickly, I want to thank you all for joining the call today, and I wanted to share Alicia's patient story. Hospice supports patients and their family members. Darius, 82, is a primary caregiver for Alicia, his 81-year-old wife. Alicia was told she has Alzheimer's disease 5 years ago, and now she has been referred to hospice care. Alicia is often confused, unable to talk, and has been in the hospital twice for falling. Darius is overwhelmed. He can't cook for Alicia, lift her, or carry her. He asked Alicia's hospice team for help. What's that Vitas solution? Alicia's hospice nurse teaches Darius how to move Alicia safely. The hospice medical equipment team installs a Hoyer lift at the home to move her in and out of bed. With Alicia safely settled in her new bed, the hospice social worker arranges for Meals on Wheels to help Darius care for Alicia and himself. You can expect many different members of the hospice team to come and support you wherever your loved one calls home, and that would include a hospice physician, a registered nurse, a social worker, a hospice aide, a chaplain, a community volunteer, and bereavement specialist. For more information and to download our Vitas guide for thinking about hospice, a discussion for families, visit our website, www.vitas.com, or give us a call at 1-800-93-VITAS. Thank you so much, Tam. We appreciate you.
Appreciate you, girl, what you do.
Thank you, Candace. Appreciate it a lot. Thank you for the sponsorship. Before we get started, let me tell you just a little bit about our wandering Tam Cummings. She's traveling today, so she's a little bitty on my picture. Dr. Tam Cummings founded her company in 2009 with the mission to inspire, educate, and empower dementia caregivers. Now her professional gerontological practice in the Texas Hill Country is recognized as one of the leading educators of dementia caregivers and program design for dementia care nationally. Tam, so glad you're with us today.
Linda, so glad you're with us.
I am, and I am with us too.
I am tickled you're with us. Just real quick, because I never have any around, and I actually have any around today. Here's our Becoming Dementia Aware book. And so if you've followed us and you need something where it's written down and you can follow it, you can actually find every chapter in here done. There's a different one that's for the family caregiver. And Glenda, the only difference is this is the professional one. So it says resident. The family one says your loved one. And then this one we got in yesterday. This is a special cover for a group that we work with that's a Baptist group. But this is the itty bitty book. So when we talk about get an itty bitty book, this one's 350 pages. This one's like 120. So this is designed to let you get through it quickly. And in the back are all of those tools Glenda and I talk about. And the whole reason the book is this size is so you can see those tools. I mean, nobody reading my books under 40, right? So they're really meant to be easy for you to read, and they're really meant to help you. So if there's anything you can get out of those, go for it. That's what I have to say. So Glenda and I were talking, as we frequently do, like, what are we going to do? And I told Glenda I was working on a little project where I wanted to see if it helped family caregivers more if you were able to look at this disease that your loved one has as a cancer and therefore make better decisions and not feel so much angst about what you're doing. And so here's an example. 34% of cancers are terminal. 100% of dementias are terminal. and we need to have a meeting. When a dementia diagnosis is made, we need to insist that a social worker, a doctor who's a specialist, a nurse, sit with our family and discuss what it is that's going to happen during the course of this disease to prepare us for it. And Glenda lit on something a while ago when she said we can't fix certain things. We can't stop the dementia, but we can take care of pain. We can take care of anxiety, depression, psychosis. We can be aware of how we're approaching a person, that we're moving slower, that we're speaking slower. We can, as caregivers, be aware of our own medical needs and do respites. And Glenda, the respite could be that I get you and 3 friends to come stay at my house with my loved one, and I go to a motel for a week and watch movies, or for a weekend. A respite doesn't have to mean you're putting someone in care in a community. That can be too much for some people at certain points of the disease, but it means that we have to build into your plan of care times where you yourself get a break. Because if the doctor had said to you, this person has cancer, it's going to take about 10 years before death will occur. In that time, they're going to get worse and worse and worse until it's the equivalent of taking care of a 100-pound infant. And you'll be doing the work of a dozen people every day. And you would say, well, that just sounds crazy. And yet that's what we do with dementia. So we've got to find a way, Galinda, to help families force our medical groups to treat this more like cancer so that we get the kind of support for families that they do if the word is cancer. And I told you, Glenda, I was a few years ago training a group of activities professionals on how they were going to do their programming for their communities. And one of them had just literally 3 days before been diagnosed with stage 4 cancer. She had an identical twin. And in the course of the first day of teaching, she had to leave the room 8 times to go answer the phone where they were scheduling meetings between her, her husband, her children, the doctors, the care team. And you and I know that has never happened in dementia. Never happened in dementia. And families in dementia are not told this is destroying the brain. It's no different than brain cancer. I actually have a set of slides I've been working on, Glenda, that I have a slide of brain cancer right next to a slide of a brain with dementia. You can't tell the difference. In both places, the brain is gone. But because you and I have an understanding of what the word cancer means and how frightening it is, and to say the word cancer and the word brain together, you have a totally different feel about it. I mean, Glenda, if you took your husband to the doctor and the doctor said he's, seems to be mild dementia, which you and I immediately know means move way ahead because nobody gets caught at mild, would you have really handed him the keys to drive home if the doctor had said your husband has brain cancer? Your wife has brain cancer. Your mother has brain cancer. Would you still let them live alone? Would you let them drive? Would you let them have a computer and the bank account? And to me, it's a matter of changing a word that we don't really understand what it means, dementia. Technically, it means incapacitation of the mental faculties. And to me, as a medical professional, that means the brain is dying. But it doesn't mean that to other people. Glenda, you and I know that. So if we don't look at the disease in a different way, how do we best support these families? And families, what helps you best? Is it to, when you get to the point where you think I can't do this anymore? If it was cancer and I said to you, the cancer's advanced and it's time to move your loved one, you would go, okay. But because there's still not an understanding of dementia, you end up with PTSD or secondary traumatic stress disorder, compassion fatigue, to where a piece of you knows what the right thing to do is, but the rest of you is too exhausted to do it. And that is a very real thing that we see, and we see it more in dementia than we do in cancer because the cancer family gets the support the dementia family doesn't. Does that make sense, Glenda?
It does. And what entered my mind was part of the problem with the dementia diagnosis and looking at it in a different way is so oftentimes the people look so well for so long. Where if you have cancer, maybe you're having a sudden weight loss, you're looking gaunt. I think that makes a difference.
That makes, I think, a definite difference. And for families, I mean, what's one of the most common things we hear? Nobody else in the family seems to notice that this person is sick. They
Yeah.
come in, they look good, they say, "Hi, how are you?" "Oh, I'm fine. How are you? Please have a seat." And the family doesn't realize you're not actually engaging with this person. It reminds me of the family that I met in the north, and the wife said, "Oh no, we have great conversations," and the brother said, "Oh, we work in electrical cutting equipment in our wood shop." I just was horrified. And the
Mm,
sister-in-law said, "Oh, we have wonderful conversations." And then they brought him in. Glenda, he couldn't put three words together that made sense.
mm,
But to the family, because of love, because you see what you want to see, because it's so slow and subtle, like you said, they don't suddenly look sick, that families don't realize they're missing clues right in front of them of how sick that person is. And the other thing is the average family caregiver in cancer, you're a caregiver 2 years. Dementia is 10 or more years. And the more that we discover about the disease and the more we discover about early markers, some of you married a second spouse and married someone with dementia. Some of you have been doing dementia care not 5 years. I think some of you have probably been doing dementia care 20. It's just so slow and subtle that you don't realize you do everything for this other person in addition to all the stuff you do for yourself and all the stuff you do around your house and your work. And it takes its physical toll.
hmm The other thing, when you mentioned about the other family members not seeing it and not recognizing it, I would think as a caregiver, that would make me doubt my own perception of what I'm seeing and saying, well, maybe I'm wrong. Maybe
I
I
think for
really
some
don't
people,
have this.
yeah. And it would make sense to me that for some people you do. And then it would make sense to me that for other people, it would make you angry.
Mm,
How can they not see this? They're not here. They're not part of it. They're not helping. And, Glenda, we talked before. Sometimes people don't help because you look like you got it all together. I
yeah.
didn't know you needed somebody to go to help. Not everybody wants to call and have groceries delivered because, quite frankly, my first thought is they're going to every old vegetable and fruit they have, and that's what they're putting in my order and deliver fruit
Mm,
basket.
mm,
So, I, you know, I think you have to look around and be honest about conversations with your children. One of the biggest things that I run into is children who are angry because their parents won't, or the parent who's not sick won't discuss the parent who's obviously sick. But then, Glenda, how many times have you and I seen a second marriage or a third marriage? In some cases, I know a fifth and sixth marriage, and those
yeah.
children don't want anything to do with that parent. There's already dysfunction in that family, and if you're going to take care of them, there's no reason for me to. And so the children just sort of check out, and you're left with you and your children taking care of somebody who's not your children's parent. And
Yeah.
that is something that's commonly seen. Last week, a man called me and told me that after 4 years, his own children had finally said no more. Her children won't help, and she should be in a community, and you won't do it, and so we can't do this anymore because it's not our
Mm,
mom. And that sounds cruel, but you have to think they didn't do this over 2 months. They did this over 4 years. They finally said, you can't keep doing this, Dad. And Dad said,
mm,
"Okay, I can."
mm.
So
That's,
it's a different
yeah.
thing, but again, I think because we have such a misunderstanding of what the word dementia means. And now that they've changed the word dementia to major neurocognitive disease, been nice if they'd sent out an email or something, maybe
Yeah.
a little bar at the bottom of the TV. By the way, dementia will now be called major neurocognitive disease. there's so much that could be done to help, and it doesn't happen. And because our families don't know to compare it to dementia, for me, every time as a family caregiver, you reach a corner and you don't know what the next road is to take, change the word dementia to the word cancer. And it changes everything. And I have told Glenda for years that I believe if we said to the family, your loved one has brain cancer, that person would be treated differently by the family. And they would quit expecting their brain to do things their brain can no longer do. Because by simply saying the word cancer, you understand that brain doesn't work right anymore. But because you didn't understand that about the word dementia, I mean, Glenda, how many times have we seen a spouse who was so angry? And it's because they're convinced that this behavior is happening on purpose and they have no idea dementia means the brain is dying.
Mm-hmm. Well, we've seen that a lot, for sure. Okay, are you ready
I'm
to get?
depressed. Yeah, I'm depressed. Let's
I
go
am.
ahead and
Me too. Yeah, really. You ready to get to some
Me
questions?
too.
Okay. Yeah,
Oh,
you
well,
too, Guinevere.
we've
Yeah, I
depressed
know.
Guinevere, so we might as well hang up now.
Oh,
Okay.
golly. Okay, Donna said, what is the best approach in deciding how to prioritize medical care for conditions other than dementia? For example, the person she's caring for has very severe COPD and needs a lot of dental work. The person she's caring for is stage 5. So do we go through the process of the dental implants or not? Mm, mm.
Uh, wow, that's a tough one.
Yeah.
Normally, somebody in late stage dementia, which is what stage 5 is, there would not be implants put in. Um, the teeth would just be removed. We have to be very, very careful. And this is something you want to ask your dentist about. This sinus pocket right here, which is what your teeth are part of, is connected directly to this up here. So if we have infected teeth, we need to get those teeth out because we can't have infections so close to an already infected brain. And then anytime that you're having to look at medical care for your loved one, you must first start with dementia is a terminal disease. So if dementia is the terminal disease, what will be the outcome of having the teeth removed? Because having the teeth removed is a day thing that can be done pretty quickly. Having implants done is a much longer, much harder procedure, and there's a healing aspect. And I haven't looked at the research, but I know that bone healing does not happen well in dementia because of brain damage, because the brain runs the body. And so I would want to ask the dentist or the orthodontist, what is the recovery expectation of this? And is this worth the pain that the person is going to have as a result of this? How long is the healing? Is this an anesthesia where it's going to be a local and we're going to numb the mouth? But do we also need to have something to keep your person calm while this is happening? Because there's a lot of banging and tugging and hitting when teeth are removed. So I would have a few questions, but I always start with a comorbidity of the number one disease. When you look on a medical chart, diseases are actually listed on the chart in order of severity. So the first always listed on y'all's loved one's chart is always going to be dementia because it's the terminal disease. The others are the secondary. So I think it's something where you really want to talk to your dentist. Can you do is it going to be an anesthesia? Is your person going to need something to keep them calm while this is going on? What is the recovery time? Who's going to take care of this person? How are we going to eat? So I think you've got a lot more questions to ask talk to your dentist about. And then at the end of the day, and Glenda will back me up on this, I've seen people with no teeth at all eat steak. So you're looking at removing, I'm assuming, infection if the teeth are like that. And just ask your doctor some more questions. And then how is this gonna help her? Because eventually this person's gonna be eating pureed food anyway. Does that
Okay.
make sense?
Yeah, is kind of the direction I was thinking anyway. So it's good to hear you say that because I was feeling guilty about, oh, do we do the teeth or not? Like how do we approach this? And then there's this secondary, very severe COPD that we're
Okay.
also
So the
carrying that along.
COPD
So,
is another dementia. Okay. That falls under toxic dementia or vascular dementia. And that would really push me away from the surgery because his brain's already not getting enough oxygen. His body's not getting enough oxygen during the day.
mhm.
With that, I would be very concerned about
Okay.
that. And I think a lot of times I fall back to, but this is just me, so you have to do for your own. I fall back to what is most comfortable and best for this person because they're dying from brain disease.
Yeah. Yeah. Thank you.
Mhm.
That's a big help hearing you say this. So,
And the thing
yeah.
that jumped in my mind, Donna, forgive me if I don't mean to offend, is the expense. You might need those funds that you might spend on having this done, and it might fail, and you may need those
Yeah.
funds later down the line. Yeah.
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 That's also been a concern. I mean, right now we can handle that expense, but who knows? We don't have long-term care insurance, so we are cash pay for everything. And so, yeah, that was one of those things, but I was trying not to make that. I wanted to make the best medical decision and not
Sure.
have a financial decision as part of that. So,
So always start your medical decision with he has a terminal brain disease.
mhm.
What is the outcome of this event that they want to happen? And then
Yeah.
the other thing, you got to remember, surgeons want to operate. That's what surgeons do. Doctors want to do. Dentists want to pull teeth. It's what they do. So you sometimes you have to put into the whole picture because
Yeah.
they're only at what their specialty is, and this is what they do, and you've got the whole scope of things at home.
Right. Thank you very much. Thank you.
Thank you, Donna, for bringing that
Mhm.
up.
I saw Summer's name come across there. Hey, Summer.
Summer. Well, I see Sheila up here. Sheila said, I tried thinking I was doing the right thing to get, and this is adding to you, Donna, to do some dental work for my mom when she was stage 4, and it was a mistake. We stopped after a few visits because it was too much stress. This is what you were saying, Tam. And my mom lived and ate for several more years until she passed. Oh, great input, Sheila. Got to look at all of the big picture, including finances, Donna. I'm sorry. I'm the wet blanket there. Lucinda said she's finding this real interesting that we're calling it, relating it to cancer. She may not have heard us talk about this in these terms. And Sheila says, hi, the person she's caring for has a caregiver to whom she is very attached. That doesn't surprise me too much. The caregiver came through an agency, but now told me her person she's caring for wants to be paid. No, no, wait a minute. Told me that she wants to be paid in cash. Is this common and legal?
Yeah, that's illegal. And it's also the company that your caregiver came to you through. She signed a contract with them that she would not try to take business away from them and become your own personal caregiver. And then anybody who wants to be paid in cash, um, first of all, that's money that should be coming reported on your taxes because you're paying it for the care of your loved one. And anybody wanting to be paid in cash trying to avoid taxes. And I mean, I don't like the IRS anybody better than anybody else, but I like having a policeman. I like having a road. I like having a fireman. I like having a military. I'm silly that way. So I would be very cautious about that. Another thing that you have to be aware of is it can very easily be time to move your loved one, and you have a caregiver that your loved one gets along well with, and you can end up having that caregiver because this is their job telling you and arguing with you against doing the thing, which is that they now need to be moved to medical care because it means taking away their job. And I know a lot of caregivers who spend a lot of time on their phone. There's not actually that much caregiving going on other than some basic things. And so I would just be very cautious. They're breaking the law of what they agreed to with their company. The companies will come after you for this stuff. I've heard of some of the bigger ones that will fire up a legal letter to you that you're not allowed to do that because you also signed a contract with this home health agency that said you would not personally hire their worker, because if we do that, then they suddenly don't have a business. And also, when you're paying through the company, they're licensed and bonded, and it gives you protection. And this person's had a background check. When a person suddenly wants to be paid in cash, that now means you're keeping cash at home that someone you're not related to knows about. This is not a good idea.
No,
No, no,
I agree totally from a social work point of view. Don't do it.
don't do it.
Don't do it. Karen added in also about to look up the I Can't Chew cookbook, which I didn't know about. That's a good resource. Talking about many swallowing and chewing difficulties. That might be helpful, Donna, also to consider that. Okay, Anna has a
And
long.
you can also chop food, you know, the little onion chopper. The normal progression of food is regular food, but then I have to cut Glenda's food up, but then she's okay, but then I need to chop her food up because she's not chewing enough. And then finally it becomes pureed. But how many things did you eat yesterday you actually had to cut up with a knife? You know, we don't
Yeah.
necessarily chew on steak every single day. So that's a great cookbook. I hadn't even thought about that. Way to go, team. Way to go, team. Get that
Yeah,
information.
I'm telling you, we can help each other so much. Okay, Anna, my siblings have repeatedly shown me who they are, and I now believe them. I have scheduled mom to be in respite care for 4 nights at a lovely facility here in town in 2 weeks. I will again use their services at the end of April so that I may spend 10 days with my children and friends at my home 2 states away. I had requested assistance from my siblings last August with these dates, a lot of notice, and have heard nothing. And I have already received negative feedback from my aunt, mom's sister, with whom she stayed last November, but no longer feels as though mom should stay with her for more than a night and expect
But
I
she
will
gave you
hear,
negative feedback.
yeah, and
Yeah.
expect that I will hear from my siblings afterwards. Oh boy.
So I don't know if you know this, but there's this handy little thing on your phone that if you will click on that person's number and scroll down to the screen, there's a little thing that says block contact. If somebody is not helping you, it's like the old saying, lead, follow, or get out of the way. You're the one putting your life at risk. You have found a lovely place for her to go to. And quite frankly, who gives a damn if they call you? Block their number. There's two famous old actresses. I think they're both deceased now, and I think they were both Oscar winners, and they were notorious for how much they hated each other. But one of them said, you can divorce a bad husband. Why can't you divorce a bad family?
Mm.
It's okay to divorce a bad family. And at the end of the day, you survive, and your loved one goes off and has a 4-day respite where they all treat her and she'll think she was someplace fun and doing some rehab. You're doing the right thing. Block those people.
I think you do know them now. I think absolutely.
Yeah. You know who you're dealing with. And you gave them
Exactly.
every opportunity in the world. And it's like so many others. If someone else is willing to do the work, no reason for me to show up. So you've got your stuff planned, go for it.
And
Go
enjoy
for it. And don't you
yourself.
feel bad? Don't you feel bad for a moment? Don't you
Mm-mm.
feel bad about it for a moment? And even your own aunt, in her strange way, verified what you're saying. When she went from I can take her several days to she can spend the night.
Yeah. Mhm.
That's telling you right there, you're headed, you do what you need to do and you have a good time on your little vacation and you kiss all your little grandbabies hello because you are teaching your children how to take care of you if something terrible happens. Your siblings, God'll get them. Don't worry. Don't worry about it. God'll get them.
Yeah, because their children are seeing how they're taking care of their mom, right?
They sure are. They're
Yes,
sure.
they are. Yes, they are.
You
Here's
did what any
Summer.
good sibling would do. Hey, Summer.
Here's Summer. What medications are essential to prevent prolonged death? My dad has FTD, aphasia, and VDs. I want to take him off metoprolol, pardon me if I murdered that, and just have him on vitamin D, CBD, THC, that's a good one, to help with sleep and pain only.
Yeah,
Would
you can't. Okay, wait, Glenda.
back it up. Okay.
You can't put someone on THC. It's a psychotic. You can't give them psychotic. I know it kind of hit a little burst, and in Colorado they even called them the dementia refugees because people started taking them there, thinking it would be helpful, but it's really not considered a good thing. Okay, so your dad has a terminal illness, and most of the time in FTDs, there is going to be an antipsychotic used because of the damage that it does to their brains. But it would be something that I think you'd most want to talk to your doctor. This is a lot of times where our hospice doctors help, is that you really want to bring it down to dad's comfortable. Is that what I'm understanding? And we don't have any medicine to stop it. So if we keep dad comfortable, that's what you're shooting for? Am I getting that right, Glenda?
That's what it looks like to me, Summer. Can you unmute your computer? I'm actually not seeing her name popping up, so.
It's unmuted. Maybe
Hey,
Okay.
Summer.
There you
Yeah.
are. Okay.
What I was trying to do was he was in a memory care facility and they doped him up on Seroquel. So they got him to come off of that. And I have him somewhere new. So we're just going over a care plan. So the VA had took him off of the memantine, and I've heard several things of leave them on to help clear the brain. So what I didn't want to do was to have him be on anything that was going to prolong his death experience. Like, I don't want to prolong a life that's not worth living, because that's against the directive of do not resuscitate to me.
Yeah. What the medication you're talking about does is it stops the brain from building up too much glutamate, which is happens because the blood-brain barrier is damaged during the disease. So normally we keep somebody on that medication to the very end of life.
Okay.
Okay. But again, these are questions, Summer, I would ask the physician.
Right.
Okay, because some medicines have to be titrated off over a period of a couple of weeks because it'll put the brain into a shock. Don't I have that happen? And then I would ask the doctor for a hospice order if it's time. Okay, and then hospice, palliative care, they're all going to be about keeping him comfortable, not about trying to prolong. And there's nothing to prolong. You just want to keep him comfortable.
Right. Yeah. I did ask everybody, and they absolutely don't know what they're doing. So it's not. So they had him on.
Summer's going to lead the March on Washington for dementia.
Right. So I mean, I've just said, look, my dad has a terminal brain disease, and he does not want to be resuscitated if he had an event like that. So this is similar. This is hooking him up like the equivalent to having him, on oxygen and things like that. I mean, it's the same thing.
Yeah, I see that some people can easily see, because when we think about extraordinary care for someone, I always think people are thinking we're talking about a ventilator, but I'm also talking about they have a terminal disease. Is this medicine helping, or is it just dragging out the disease? So I think you're asking great questions. I think you do better if we ask your doctor, the one that's writing the medicines for him, just to make sure you've got everything covered. And then also ask about if it's time for a hospice order. Because remember, and Candace will tell you, our country, the average person uses hospice 5 days, and it's meant to be in place a year. So if it's time for your dad, let's get him comfortable and do everything we can to keep him happy.
Right. Okay.
Sounds like
Right,
summer's on the
Summer.
right track.
Doesn't Summer Miller sound like either an actress's name or she writes fabulous books? I just completed. I got the new Summer Miller book. It's going to be so exciting.
Absolutely. Let's see, back to Anna and her respite care. She said the facility director she spoke with yesterday asked her if the upcoming visit was a test for long-term care, which respite can be used for that, or just a break for me, and she answered both. That the two planned visits would be a test balloon to see how mom does at the facility. So this will be her
The
first time.
average, Glenda, I think the average is a little over 90%. If you take your person for respite care, there's like a 90% turnover because you get them there and you realize how exhausted you are
Mm,
and you realize that they are getting good care.
wow, that's a big
So
number.
it's a big turnover number. So yeah, and then for other people, I mean, it's all about finances, right? I
Yeah.
mean, I may only be able to afford to do that every 3 months, but I know that once I get my feet back underneath me, I can go for 3 more months till there's another respite care. But for a lot of people, if there are funds available, once a person's moved to respite, they realize this person gets better care, they have more activities, the people around them aren't exhausted, there's stuff happening all the time. And the best model that we have for care in dementia is social. And that's why there's so much social stuff, social
Yeah.
activities. Yeah.
Yeah. And so I'm going to jump down to Anna's next question. Speaking of finances, how is the current political calamity going to affect caregivers and their loved ones? I don't.
All I can say is we're all going to hell. That's all I know. It's just probably all going to be bad. It's going to be bad, bad, bad. But Glenda and I will still be here, and we'll be doing whatever we can to help. I have no idea.
No, I
We
don't
have
either.
members of Congress with family members, spouses who have had dementia, who've died of dementia, and yet there's no the money put into the federal budget for dementia care, for dementia assistance, for dementia research is nothing. It is like $500 million, whereas the continuing care and research for HIV is, I don't know, 50 billion.
Something,
The
yeah.
research for cancer is in the billions. And again, 34% of cancers are terminal. And yet the research for dementia and the numbers for dementia are not correct. The numbers that you hear are only the numbers for Alzheimer's. Alzheimer's is not 80 or 90% of the dementias. It's thought to actually be closer to 20%. So, Glenda, we're not looking at by, I don't know, in the next 10 years that we'll have 13 million people with dementia in this country. We're looking closer to 26 to 30 million people in this country. And we still don't know what are the effects of meth. Cocaine actually causes a vascular dementia for people that were big in cocaine use. We have all these other weird drugs out there. We don't know if people are going to survive and get to those. Oh, yeah. Anna, thank you for the plastics in the brain. Yeah, that's making me feel good. And
Oh,
then
yeah.
so much of this goes back to diet and exercise. We don't move enough, and we're eating processed foods all the time. And it's just, we've got to, I think it's, I have no idea. I wish I could tell you that the people leading the country are going to suddenly wake up and say, let's do good stuff for old people and let's take care of people with dementia. But I don't know that that's going to happen anytime soon.
Well, we were so terribly underfunded from day one.
Mm-hmm.
Speaking from my background in an area agency on aging, that I can't imagine that anything they do is going to make that much worse.
Those
It's
funds are,
just a drop
it's all
in the
being
bucket
kept.
for
Yeah.
help for caregivers. So I'm sorry.
In terms of research on something this complex, it's more complex than the HIV virus, and it took the entire weight of the federal government's checkbook to get us through to that. And nobody's doing anything, and I don't know if it's because it's older people, so who cares? I don't know. I just know there's a lot more coming, and it's not just the end of the baby boomer population moving through. I'm at the very end of the baby boomer population, and I can promise you, I grew up exercising with PE in school. I still work my body, and I don't eat processed foods. But if you look at my nieces and nephews and my great nieces and nephews, it's going to be a different thing for them.
That's
So
true.
just got to take care of ourselves, y'all.
Yeah. Oh, and let's throw in that little thing called long haul COVID in there too, that we're learning more about. One more little golden nugget. Lucinda, have you been with us before? You can unmute your microphone and I would just be interested. Well, okay, it doesn't really matter, but I'm hoping you found us and will continue to join us. Lucinda says, hello everyone. I have become my husband's caregiver with other health issues, but this information I feel can help me. What happens to my husband? Wait a minute. Can I help me? What if, yeah, okay,
Yeah.
Lucinda, help me. I'm trying to read what you wrote.
Well, yes, I just recently became my husband's caregiver, and
Uh-huh.
he has other health issues. He has congestive heart failure and with other things. He hasn't been diagnosed with dementia, but I'm the type of person that I like to be proactive rather than reactive. And I'm trying to learn as much as I can. So I really enjoy these meetings. I see some memory loss. He hasn't been diagnosed at all, but then I even feel that I have some memory loss myself, certain things that come up personally. But then my husband also has a hearing problem, so it could be that he's not hearing me also. So it's been an interesting journey. I just became, I mean, it's funny because people say, well, haven't you always been his caregiver? And I said, you are right. I've always been his caregiver. It's just now it's like more official.
Mhm.
And so this is my journey.
Well, CHF would be, we would be looking for strokes. You would assume you have a vascular dementia there. How old is your husband?
73.
73. If he's beginning to repeat questions, information, stories, then Alzheimer's will have started as well because it destroys the hippocampus. He may have funny sleeping patterns. He may wake up real bright and full of energy, but then sort of peter out during the day. He may wake up real slow, but get more energy as the day goes on. He may take naps that are several hours long.
Okay. Yeah, I am
Okay, so
seeing some of those things. And actually, my husband had quadruple bypass when he was 52.
okay, well, we would consider that a cardiac event. So
Yeah.
your
And
kiddos need to be checked by a board certified cardiologist.
uh-huh.
And we want board certified because those are the people that are the valedictorians of the class. So we want the top people. They need to check your kids and make sure your kids have not inherited what if they got their gene from their dad. Okay,
Okay.
so let's hope they got mom's gene. Go mom's gene. And then let's go ahead and get your kiddos checked so something doesn't happen to them as well.
Thank you for that.
Lucinda, have you found Tam's website yet where she has a lot of resources for you there?
No, ma'am.
Okay, I'll put that in the chat box. And so be sure to go over there because we talk about a lot of these screening tools and documents, and you'll find them there and it'll be helpful. And keep coming back.
Yes, thank you.
Okay, Annette. Mom's daycare contacted me that she was agitated and requested a doctor's visit. The doctor checked blood work, urine, which were fine, but put mom on trazodone in the afternoon. This has helped a lot to improve sleeping at night. The daycare reports that she is still agitated, verbal and physical. Is this a normal disease progression?
It could be, but the first thing I'd check her for is pain. So go to the tools section and look at the pain ad, PAINAD, and let's check mom for pain because trazodone is affecting some of the pain, which is probably helping her sleep better at night. But any time we see verbal or physical Acting out, the first thing you're always going to do is check pain because it takes 5 seconds to do. Nobody knows her better. And remember, even a 1 means I hurt. Okay? So let's check for pain.
Does it make a difference what kind of dementia that her mom has as far as the behaviors that they're seeing at the daycare?
How old is mom?
Annette, can you unmute? She's 98.
Oh, for God's sakes, do her pain scale. And then tell the staff there to shut the hell up. Your mother's earned the right to be as crabby as she wants to be. She's in her 9th decade, which means she's in her 10th decade, moving into her 11th decade of life. And there is no way she's not having pain.
Mm.
So let's check her pain first. Okay. And then also, let's just so have her look right at your nose and then bring a pen. I got a pen right here. Bring a pen forward and tell me when she can see the pen. Okay, if she doesn't see the pen back here, your mother's lost peripheral vision, which is normal. Okay, but it would mean that she may be having behaviors because the staff is startling her. Okay, and then somebody mentioned a while ago, their husband also has a hearing issue. Any of your loved ones who have severe vision or hearing issues, you're going to have more behaviors with. You're also going to have more paranoia because they can't hear what's going on around them. And it's not, Glenda, because they need new hearing aids. It's because the area of the brain that translates sound doesn't work anymore.
Mm.
Okay. Which is why we always come from the front, move slowly, and make sure we're in eye contact with each other. Otherwise, I can't trust that this person can actually see me.
Yeah, and that clarifies that she can't hear and she has macular degeneration. So that
So
goes
there you
right
go.
on.
So the daycare, yeah, they need to pay more attention because what they're not understanding is she's seeing this with a circle of stuff around here. So she's seeing part of people move. And Glenda, if I just sort of suddenly appeared out of nowhere and disappeared and kept doing that during the day, you'd eventually swipe out at people. So I think you've got a retraining of the staff that she doesn't see well, she doesn't hear well. And then let's do a pain ad on her.
Mm,
Okay.
wonderful.
Mhm.
Okay, Summer, what is the best medications to consider for pain? We use 1,000 milligrams of acetaminophen, 600 milligrams of ibuprofen for acute pain, but not sure if that's okay for long term.
Yeah, you need to talk to the doctor about that because you can have something that interferes with kidneys, something else that interferes with liver. So you need to ask the doctor. Your person, just as a rule of thumb, can have up to 3,000 milligrams a day of ibuprofen, Tylenol, or Aleve. But the doctor needs to know which one they're doing because these are actually very, very dangerous medications. And we're talking about a pretty high dosage of it. Your person can also have narcotic pain medicine. You're going to have a harder time getting that because the doctor's going to say, oh, but they could fall down. Well, they're going to fall anyway. They have dementia. But yeah, we take care of pain, and that's something that you always want to watch for. And then you want to be aware if you're in an area where there is a storm coming. Your person with arthritis begins to feel the effects of that storm 2 days before the storm gets there because the body is already picking up the effects of the changes of barometric pressure. So we always increase medicine before a storm starts because you always want to say in front of pain, not behind pain. Okay. And then for the dosage you're talking about, Summer, you definitely want to talk to your doctor about that.
Yeah.
Yeah.
Lucinda, being new to our group, she said that she's read about how important hearing and vision are in the dementias. And we talked a little bit about that, but I know that you've talked in the past about how that changes through the process or the staging of dementia also.
Well, yeah, the as the brain is damaged, it's not that I need new glasses. It's brain damage. There's nothing you can do. So my vision goes, I lose peripheral. Then it's as though I'm looking through a submarine telescope. Then I have binocular vision. And you have to understand with each one of these, I move differently, Glenda. So when I've lost peripheral vision, I turn my head when I'm talking. When I'm at submarine vision, I reach across the table and take someone else's food because I can't see right in front of me anymore. I'm losing my visual field, which is this thing all around me. Then when it becomes binocular vision, I now have to twist at the waist to see the people around me. And then for some people in stage 6 of the disease, they will develop occipital blindness. The right occipital lobe will lose the connection to the left eye, and this is actually what they see. So if I don't approach from the front, come towards your eyes to where I'm right in your eyes, you don't see me. And if you're a fighter and I suddenly startled you, you're going to hit me. I don't get in trouble, you get in trouble. Right? And it's the same thing for this. We have to slow down our movement, slow down our speech, and recognize these brains are heavily damaged. And so we have to adjust our behavior. Your loved one can't adjust theirs. And it doesn't usually change personalities. So if they had a personality, now it's on steroids. And if they were an introverted, more of a type B personality, it can be even more introverted. Okay. Hearing changes, Glenda, not because I need new hearing aids, but because the pieces of my brain in the different lobes that translate sound and noise, language and speech, those things don't work anymore. And the hard part is there's a point where I need to amplify, Glenda, to help you, because if I can amplify, your brain making still grab it. The trick is I have to amplify without looking like I'm yelling at you. Because if I get right up in your face and I look like I'm yelling at you, you better get ready to prepare yourself, right? This person's fixing to hit me. So we have to pay a lot of attention to the senses that they have that are still working and recognize that they're not going to continue to work the way they always have, again, because of the brain damage.
Hope that was helpful, Lucinda, because you're right. It's so important. Ms. Guinevere would like to know, how do you proceed to attain respite care?
You just call me and Glenda and we come by and get you. We're going to slow down. We're going to honk twice. If you don't show up, we'll circle the block, but we'll come back.
Yeah.
Sounds good.
I'm going to come get you, Miss Guinevere. You know, he's VA, right?
Yes, and he's 88 years old, but he's functional.
Miss Guinevere, he is not functional. You've been on this call with me for 100 years. There's no
I know.
Is there a way, is there any chance he's going to have a toenail fixed or anything that would get him to the VA and they could keep him for a few days?
With his intelligence, probably not.
Okay. Is there a way to hire somebody to come stay with him for 48 hours or for a week so you can go to Virginia and see family?
You mean 2 weeks?
Ah.
I respect you, my friend. I respect you. Did you see that, Glenda? She went right away from that 1 week.
She did. The heck with 1 week. Hey, Guinevere, have you been in touch with the area agents on aging down there? Some of them will pay for respite care.
Yeah, I was told about 3 years ago that it was 2 indications that I could possibly acquire respite care, but that's when I was very new into all of this.
Well, circle back and see. I mean, it depends on where it is. And like I said, everybody in the area agencies of aging are so underfunded. But circle back and see if they have some money there for respite care. So, I mean, 2 weeks would be wonderful, but maybe 1 day out of the week, something where you could get some relief might be helpful.
Yes, I appreciate that. I'll talk to you more, Dr. Cummings.
Yes, ma'am. You reach out to me. I have your address.
Yeah, don't bill me.
I'm not going to bill you, ma'am.
Thanks, Guinevere. How do we know, this is from Belinda, how do we know if we will develop dementia? Is there a test? My mom and most of her siblings suffer from dementia, and a sad face that goes along with that comment.
So, most of the time when we talk about families where we look back and go, this family's got it, it's not actually Alzheimer's, it's vascular dementia because we're much more likely to inherit vascular things. So, first of all, you want to find out what it is your mom and all those aunts and uncles have. And if it's vascular dementia, we want you to see a board certified cardiologist so that we can make sure you get a full cardiovascular workup. And then here's the breakdown. 70% of your aging has nothing to do with genetics. It is how you live your life, how you take care of your body, how you work out. Okay. 20% of your life is luck. You didn't get run over by a bus. You didn't get sent to war. You didn't develop some weird disease, right? 10% is genetic. Okay. So first thing I have to find out is which one does there seem to be in my family? And then doubtful that it would be an Alzheimer's, much more likely that it would be a vascular. And a vascular is something that we can get a lot more help for. So we need everybody to see a cardiovascular doctor, board certified. Okay. And the reason I say board certified, Glenda, common sense tells me 50% of the class was in the bottom half because we can't all be valedictorian. But board certified says this is the smartest person in the class. So that's why we want you to see board certified cardiologist. Okay. You want to take your family history, any reports that you have, MRIs or CAT scans, because they're going to pay more attention. It's going to be very interesting to them, and they're going to want to catch something sooner rather than later.
So that you're saying then that 90% is not genetic. That's a pretty
right. Makes you feel pretty good, doesn't it?
Reaffirming, yeah. I like that.
Pretty good. Yeah. So it really is. And that goes back to looking at the Million Veterans Study, the longitudinal study, that it is an hour of exercise a day, no smoking, no drinking, no opiates, keeping your stress level normal, getting enough sleep, eating a Mediterranean diet, and having social contact with different generations.
There you have it in a nutshell. If it tastes good, spit it out. Isn't that what you
That is the cardiologist diet. Yes. If you put it in your mouth and it tastes good, spit it out. That's the diet that the cardiologist will give you. Yes.
Exactly. Circling back, I know it's 11 o'clock on the hour. So Lucinda said, we were talking about hearing and vision. She said, it's so true. When her husband uses his hearing aids, he tells me, why are you yelling at me? So he's picking up on that. I remind him that this is the tone that I have to use in order for him to hear me, but he may not understand that.
You need to remember that you reminded him, and he probably doesn't have a piece of his brain that can hang on to that memory. So you remind him again. You remember Coach Darrell Royal?
Yes.
UT?
Yes.
His wife, Edith, was talking to me one day, and she said she said, if I could have just pushed him out a window right then, I'd have done it. I was so tired. I'd said the same thing to him over and over and over and over and over and over and over. And finally, I said it to him again in a loud voice. And she said, he looked at me and said, Edith, I'm not deaf. I just have dementia.
Oh, my goodness.
She said she still wanted to push him out the window. But, you get frustrated, and that's normal. Okay. When you feel yourself getting frustrated, get out of the room, walk away, go outside. Even 5 seconds, Glenda, lowers your blood pressure. Okay. Step outside, step away. These are not arguments you're going to win. So stop it. Just stop doing it. It's not worth it. It's not worth it. Just step outside, step away. You can, because of their brain damage, Glenda, I can have an agitated person step out of the room, put a jacket on, put a baseball cap on, go back in the room. They'll tell me about the bad caregiver that was just in here. And it was me. Okay, so step away, calm down, do your breathing. Remember, our quick breathing is into 4. 1, 2, 3, 4. Hold for 2. 1, 2. Blow out to 6. 2, 3, 4, 5, 6. Hold for 2. Breathe into 4. So you're breathing in 4. Hold for 2. Breathe out to 6. Hold for 2. Breathe into 4. As you repeat that, because your out breath is slower, Glenda, that slows your respiration down. And if you get from 14 breaths per minute down to 8, that's prayer or meditative. But in the short term, in just 4 breaths, you'll calm yourself down because you're frustrated because you don't understand. It's no different than if it was brain cancer. And if you think of it as brain cancer, it really takes some of that anger out. And you don't need to be embarrassed or upset that you've been angry. You don't need to feel bad that you've had moments where you've snapped. Quite frankly, something would be wrong with you if you hadn't snapped occasionally. Do you agree, Glenda?
Oh, totally, totally. I was just thinking, go to the freezer and grab out that ice cube and hold it in your
Okay.
hand.
We have not done the ice cube in a long time. So here's the ice cube trick. You are feeling yourself completely overwhelmed. You literally cannot think any further into what's going to happen next. Go to the freezer, get an ice cube, wrap it in one hand, go to the sink, shut your eyes, and breathe. On about the 7th or 8th breath, your brain's going to go, whatever it is in the hand is burning, and you need to drop it. So go ahead and drop it. But your brain is going to start shutting down all those extra windows you had opened where you were worried about what if, and coulda, woulda, shoulda. It's going to shut all those down because you have something in your hand that's freezing, burning, dripping, wet, and cold. And the brain's job is to monitor the body's systems. And so the brain has to shut down all that worry, all those what ifs and coulda, woulda, shouldas you have going on, and come back to what did you just do to your hand? Drop the ice on about the 7th breath. Keep your eyes shut. Go ahead and finish 10 breaths, and you should be calm. Now, Glenda, one time I have done this with a person, and her anxiety was so high, she couldn't do this. So we had to first get her to the doctor to treat her anxiety because
Wow.
she was just so overwhelmed by what was going. And she had during the pandemic, she had gone to another state, got both parents, brought them back, took care of them. One of them had passed, and now the other one had to be in memory care. And so she was just as stressed as she could be. Also, remember, if the person you're doing care for is not your spouse, this can also affect your marriage. So be aware that you may feel stretched and pulled in 1,000 different directions. That's normal. Be aware that you may have a spouse who's not happy about this. That's not unnormal. And just be aware that everything you're feeling is real. You are overwhelmed. You probably are exhausted. And Glenda, one of the neat things about dementia is if I work at it hard enough and then I get overwhelmed, then I can't remember stuff either. And I start to think, oh crap, I've got it too. So it is normal when you're stressed and you, especially living with a person with dementia, that you begin to think you have it too. And you don't, you just need rest. Yeah, absolutely.
You saw that little survey popped up. Thank you for taking a couple of seconds to do that.
I did. I gave myself all 5s.
Yeah.
Came up on me too. I was like, and I'm good, and I'm good, and I'm good.
Oh, and Belinda, I'm sorry for your loss. She lost her mother a couple of months ago. Not sure what happened. The death certificate said heart attack with a history of Alzheimer's. Yeah, I don't think that's that unusual.
Well, they're actually now supposed to put down the death cause as the heart attack actually had a causation in the dementia to try to keep better records. But I'm sorry about your mama, and I'm glad her suffering is over. And I
Yeah,
know that doesn't sound right, but you know what I mean.
she does know what you mean. And Sheila says, thank you so much. I do feel overwhelmed at times and I'm scared about developing dementia. When you're there in it, Sheila, and you're seeing it, yes, I can understand, you know.
Professional caregivers who work in buildings think they have it because
Yeah,
they're surrounded by it. Yeah, normal thoughts, normal thoughts.
all normal, all
I've
normal.
thought of having dementia, but then I remember what you say, Dr. Tam, and I calm myself down. Like,
Right.
no, don't go there. You're just stressed.
You
Yeah.
know, and it happens to me, and I know all the tests and I know all the answers, right? So the other day I thought, okay, a little stressed today. How many animals can I name in a minute? Because that's
Ooh,
one of the SLUMS tests. And so I named how many animals in a minute. Things you can do a little bit different. If you're right-handed, brush your teeth with your left hand. That gives it's a little brain exercise. It's a helpful thing for your brain. Try doing things just a little bit different.
yeah.
Okay. And then it is not normal to think something's wrong with my brain. That's not normal. But it is normal to be so stressed that it feels like you're not thinking clearly. Okay. And remember, anxiety is when you're thinking in the future, what if, what if, what if. And remember, we see families get so caught up in what if that they don't move their loved one because what if when we go to move him, he's going to have this big fit. It turned out there was never a fit. But for 3 years, she had worked up this what if, what if, what if. And then coulda, woulda, shoulda. That's depression. That's living in the past. And a lot of times when people learn more about dementia, they begin to get upset with themselves and depressed about it. Don't do that. Every human does the best they can at the time with what they know. And when we know better, we do better. And at the time you did whatever that behavior was, you did it because you thought it was going to help your loved one. You just didn't know that that's not the way this disease works. It wasn't anything that you did that was bad. It's just not how this disease works.
Yeah.
Okay? You're all doing a great job. Please get some rest. And I know you're not resting because I don't know if you know this, your emails have a timer on them. So I can tell you sent me an email at 2 in the morning and you should be asleep at 2 in the morning. So
Mm.
let's get some rest for you. Okay? And ask for help. Reach out to your area agency on aging, reach out to your VA, reach out to your church, to your family. Well, not that family. That one family.
That one family, no, don't reach out to them.
You don't ever have to call them again. We're just taking them off. But reach out to others,
Right.
and let's see if we can get you through the next 3 months.
Meredith, did you have a question or comment before we close? I see that your computer is unmuted, your microphone. No? Okay. Well, y'all keep on keeping on and keep on coming back. You're doing a wonderful job. I'm hoping that reframing dementia into thinking about it as cancer, it was helpful today. I know it was for me, and I'm hanging on this 90% that has nothing to do with dementia and genetics. So I'm
Doesn't
hanging
that
on.
make you feel better?
Yeah,
Yeah.
it makes me feel a lot better.
Yeah.
My
And
chances
people
are a
are
lot.
so worried about it. Yeah. 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 And I mean, Glenda, you're one of the healthiest people I know. Every time I talk to you, you are pickleballing. Well, I probably shouldn't say that out loud. You pickleballers are on the outs with a lot of people, but you're Pilates, you're walking, you're working. It is continuing to move and use the human body. Okay, so just keep doing what you're doing. And remember, you can have triggers that when your person does a certain thing, it triggers you. If you recognize that that's a trigger, step away. Okay,
Yeah.
do things that are treats for you. We know some study out of Baylor University, Sickle Bears, shows that a family caregiver who keeps a gratitude journal, and a gratitude journal is here. I've actually got one right here that my phone is sitting on. A gratitude journal, every day you've got to write down 3 things you're grateful for. It's all it takes, 3 things. In 21 days, your immune system will begin to boost itself. Stay off of the news. Don't watch those news stories that are trying to scare the crap out of you. Stay away from that. You got enough things to worry about. Okay? Eat good, take care of yourself, if you're like other people during the pandemic and your drinking began to go up, you need to try to bring it back down because that's not good for us. And then I'm always available. Glenda's always available. Glenda puts my phone number out. You really can call me.
You can. She's out there and she's traveling around helping people around the country. And I'm proud to be an associate of yours. I'll call it that.
Yes, my associate Glenda.
Yes,
Yeah.
your associate. After all these years, I'm something like that. Thank you so much for joining us today. I hope that you got the information that you needed just for you out of this session today. And we'll be back in a couple of months. So watch the calendar and stay well. Take care of yourself during the time we're apart. And if you have questions, send them to Tam, send them to Minerva, and we will talk about them on our next session. So, Karen, you're saying bye-bye. Bye-bye, buddy.
Bye-bye, y'all.
See ya. Bye-bye.
Bye. Bye, Glinda.